Magnesium is a mineral that's important in every part of the body, kidney, heart, and muscle especially. It is good for your teeth, your muscles, your bones. For your entire body, magnesium is essential. Usually you can find it in green leafy vegetables, grains, nuts. Muscle spasm, weakness, restless leg, right? Nausea, vomiting, arrhythmias. Well, there are quite a few different forms of magnesium. We have magnesium citrate, aspartate, sulfate, glycinate. They're all different salts. They all absorb very, very well. The one that doesn't absorb very, very well is magnesium oxide. Magnesium oxide is milk of magnesia, so it acts as a great, great laxative or antacid. I would surely recommending you use magnesium glycinate. The reason being is it probably will not cause diarrhea. In fact, it doesn't cause diarrhea, and you get great absorption. Magnesium citrate is fine, except it can cause diarrhea. Magnesium citrate, as you well know, is citrate of magnesia. And we all know what citrate of magnesia does. It causes diarrhea. Anywhere between 250 to about 750 milligrams a day, really depending on what you're using it for. I'd like to see you take a vitamin B6. Vitamin B6 helps with the absorption of magnesium. I would also like you to take things like vitamin B5. The reason being is it's good for stress. It helps to normalize the adrenals.
These studies were commenced about starting 40 years ago, literally thousands of studies into magnesium and its effect and how it works in the body and what happens if there's deficiencies. So it became more and more known in certain circles that magnesium had to be supplemented one way or another. One of the things that you'll see nails magnesium to use it up quick is stress. So when people are under stress, which we live in an environment where people are snapped into sympathetic stress and often stay there for periods of time, or if they have to use their brain extensively, where this is the mind age where people are sitting at computers a lot of time, and they're also having many demands upon them. The more everything became automated around us, the more was demanded of us to get done in a day, and people end up juggling a lot of things. Their cell phones ringing, their Skype messages, their iMessage, whatever is happening, they're being pulled on more than ever, and that adds to the whole stress factor. So the more you use your brain, the more stress you're under, the more magnesium you burn, because magnesium is a fuel rather than just a resident element, and it does reside in the body, in the bones, in the digestive tract, and so on, in the tissues of the body. But it is being used as a fuel, so the blood needs magnesium levels to be constant in order to supply all the cofactors to enzymatic processes and things. And so it gets used up a lot more in this society we live in than ever before. So if a person is not consciously adding it into the body more than normal because they're not getting enough in the food and they are under stress, then they become depleted. And multiple signs of magnesium deficiency will begin showing up. And that's really what's going on.
Okay. Well, why, you just mentioned that it's not showing up in the food. Why is that? Why is it not showing up in the food?
Well, the main reason is the monocrop agribusiness production of food today. If a person is more conscious to eat higher chlorophyll-containing foods, green foods, and so on, they're going to get more magnesium than the average person, which is definitely the best way to go as far as receiving it orally. People that are taking magnesium supplements are putting themselves in danger because, unfortunately, people have realized this need for magnesium in the society, so they ran out to buy the cheapest materials they could find and produce a magnesium product to be taken orally, which does little to no good and often is far more harmful than doing a benefit. So this is something that people are just in general finding a problem with.
You know, I just asked about some of the reasons that people become deficient in magnesium, and this is so critical, but it's hard for people to kind of wrap their minds around this, that stress can actually pull this from your system.
Just on that note, stress is really, it's not that stress is pulling it from the system, it's using it, it's burning it, it needs
Right.
it.
Okay.
The body, the brain needs magnesium to function well. So when people are under stress, their brain is working overtime, and their nervous system is also working overtime. They're running from the tiger under sympathetic stress. So
Right.
you are going to be burning fuel in that, and one of the major fuels is magnesium.
Wow.
So
Wow.
it's a very intense element. It doesn't burn like a fire in your body, of course, but it is the ultimate fuel, and that's why this is one of those things that became at the top of the list and first and foremost needed by people to keep a nice, healthy equilibrium in their body. And there's so many functions. There's more than 300 enzymatic functions, bioreaction functions in the body requiring magnesium. So when you're low, you're just not operating at your optimal.
So why is this whole magnesium? No, one of the things that I talked about at the very beginning was the fact that 80 to 90% of the population is deficient in magnesium, and we live in very abnormal conditions than what we've evolved with as human beings. Why is this such a big issue, more so than ever for us today, in making sure that we're getting enough magnesium into our body? Why is this such a big issue?
Well, there are many different threats that are involved in not having enough magnesium for your body to utilize as a fuel. It affects you dynamically in every area. It'll affect you socially because you will be automatically anxious for no apparent reason if you do not have enough magnesium. And therefore, you will be more reactive in your relationships with people, and you're not going to be able to handle the stress properly. Your heart function, your brain function, your nervous system, all critically depend upon magnesium for the fuel. So you're putting your health at risk, even to the point of being, having something fatal happen if you get low enough. And so it's just such a simple thing. Magnesium repletion is easy to do. Now, when you mentioned that a large percentage of the population is deficient, even those people that are taking magnesium supplements are deficient. And that is because most of the supplements are not absorbable. So the whole key to making money in an industry is to make sure that the people have a great need all the time. So, find a need, fill a need, but you don't really want to fill it because if you fill it, then they're not going to buy very much, right? So the idea is to get them to think they're filling a need. And I don't mean to say this in a bad way, but this is commerce, unfortunately. Most companies are in business to make money from their products rather than deliver the real value proposition to their clients. So people are hurting their bodies by taking various magnesiums internally, and they remain deficient. They continue trying to find out why. Well, I take magnesium and I still have all these symptoms. I don't understand. Or they take magnesium to get relief, but then other things crop up. So this is a huge issue, and this is what we had to address.
Well, let's dive in deeper on that. You mentioned that it has some effects on your brain function, muscular function. So what are some of the things that magnesium is responsible for in our body specifically?
Well, I guess the primary thing you would look at is from a top-down level, you're looking at the enzymatic process. So more than 300 bioreaction functions in the body require magnesium. That's the start. So if you don't have that supply, then the body has to go and find magnesium to make that work. You need it in your blood. So people have low levels of magnesium in the blood, then that's going to affect heart rate, blood pressure, nervous function, your ability, your brain, like you got brain fog. People get headaches because the brain has not got enough magnesium to use, and it's scrambling in the body to find out where to get it from. It's going to pull it out of the bones. It's going to pull it out of the tissues where it really needs to be. Now, if it depletes what's in the tissues, then that's where you get into danger to the point of fatality. Okay, so as far as function of magnesium in the body, it's called a natural tranquilizer or an anti-stress mineral. So it's going to relax the nerves. It relieves tension. It assists digestion. It's a big one there because it's actually stored in the digestive tract. It activates the enzymes which are important for protein and carbohydrate metabolism. It modulates the electrical impulses across the cell membrane. So your cell membrane potential is dependent upon magnesium in the system to use. So it's important in the production and transfer of energy, muscle contraction and relaxation. So, people get contracted muscles or tight muscles. It's all based on magnesium depletion. And also nerve conduction. So it aids regularity. It's necessary to keep the vertebrae in their proper position. Bones are entirely dependent. Your calcium-magnesium combination has to be in proper balance for your bones to be in good shape. Having magnesium in your body properly is going to induce restful sleep. It's not just that you can go to sleep. You want to have a deep, restful sleep. You want to get into deep delta sleep because you're producing your human growth hormone when you're in your deepest sleep between 2 and 4 in the morning. A lot of times people will wake up around 2 o'clock in the morning and they'll lay and toss in bed because of magnesium deficiency and they don't even know it. It also is used to purify and purge the body tissues, combating acids, toxins, gases, impurities, and it also works to neutralize poisons. And if if a person has a high fever, they get some magnesium in them, fever starts to go down. So magnesium is stored in the bowel, nerves, and ligaments, and in the bones.
High blood levels of magnesium were associated with an almost 40% reduced risk of sudden cardiac death. And women in the highest compared with the lowest quarter of dietary and blood magnesium had a 34% and 77% lower risk of sudden cardiac death, respectively. Another 2011 study noting magnesium is an essential mineral in whole grains, leafy green vegetables, legumes, meaning beans, peas, lentils, and soy, and nuts, as well as seeds, that acts as a cofactor in hundreds of enzymatic reactions in the human body. A considerable body of evidence indicates that a higher intake of dietary magnesium may favorably affect a cluster of metabolic and inflammatory disorders, including many of our top killers like diabetes and heart disease. So, did they put a whole bunch of people on whole grains, beans, greens, and nuts? No, they gave them a pill. A randomized double-blind controlled crossover trial, and indeed magnesium pills did improve some biomarkers in the bodies of the overweight individuals studied. But come on. In fact, even the Harvard nurses study threw up their hands in defeat, since most Americans do not meet the RDA, even taking pills. Therefore, we need more pills, and put it in the water supply and start fortifying foods. I mean, there's no way, apparently, that Americans are going to start eating spinach or something. It's true, though, that most Americans eat so poorly that they don't even get the measly recommended daily intake.